You're tuned in to RX Radio.
So lately, something I really enjoy is just like, it's just going for a walk. I feel like my brain just kind of wanders and I let it. And it's like, sometimes it'll wander to places where I want it to be. Sometimes it'll wander to like more stressful things that I need to like sort out in my brain, and just kind of, it gives me time to think of it. But, so last Sunday morning, not last, it was the one before, um, went for a walk. Me and Corey went for a walk. It was like 8:30 in the morning. It was a nice Sunday. It was like kind of cool out, fall weather. I live in a pretty quiet neighborhood. I'm not downtown or anything. Like, there's a little bit of traffic because there's a bus stop on this road, but it's not like, it's pretty chill. We stay away from the crazies. It's pretty quiet, like pretty residential, like family oriented. And there's like this one road to walk down. It's just two lanes, one lane going each way, and it's lined with like bigger houses, like older houses. And there's this one, it's like a really nice house, kind of set back. They've got like the nice landscaping in front. They got a gate up front, and then like this like white kind of like stone wall up front. So walking by, and just kind of whatever. I just see this guy there. He's just sitting there. This guy's fucking sitting on the sidewalk, jerking his dick at 8:30 in the morning, just watching traffic go by. So I fucking yell at this guy. I'm like, "Yo, buddy, you can't jerk off here." And, as you would.
I don't know if one would, as you did.
Yeah, so I had a degree of separation. I was on the opposite side of the street, so it's like, I'm not going to get hit with any shrapnel here. So I felt pretty safe, like intervening from where I was at. So, like, of course, he snaps out of his masturbation stupor and he covers his dick like he's embarrassed about what he's doing, and kind of like looks up in like both ways, like, no, I don't know where I wasn't jerking my dick. It's like his mom walked in on him or something. And I'm like, all right, this is wild. This is something that no one wants to see on their Sunday morning walk. I mean, I continue to walk. This guy just keeps going at it.
Come on.
He just keeps going at it.
I mean, like, you got it. At that point, you're committed, right?
He's committed. Yeah. He was going to nut on the sidewalk that morning, regardless of who told him he couldn't jerk off there. It keeps going. So I'm like, all right, that was insane. I'm glad I never have to see this guy again in my life. I was like running some errands and stuff, like drop some shit off at the laundromat. I had to pick it up later that day, of course. So this guy just like roaming the general area. I encountered this guy 3 times in one day. The sidewalk jerking off guy. One time he was just yelling at the wall, like senseless. Like, it's some mixture of like schizophrenia and meth. I think it had to be. And then I see him again later on the park bench, just like looking disappointed in himself about the way that his Sunday went. And I couldn't help but to share in that disappointment.
I was going to say that when I run into crazy people like that, which I think, I've been to your hood. I used to live not too far from where you lived. And right. Where I live now, like, I run into people like that more often than sometimes. Like, they're fairly free. Now, yeah. the dick in hand jerking off thing is a bit much, but every time I run into a crazy person on the street, and this is like a sign of age, I understand them a little bit more. I get it. Like, I'm a little bit.
I kind of want to jerk off on the sidewalk too.
You know what? Like I just want to know the arguments that this guy has had in his life to drive him to this point. Like, where this is the better option. This is definitely the better option.
That sounds like freedom. I mean, until he gets cuffed and put in jail, that's freedom. That man is free.
Yeah, he's free from giving a fuck. That's for sure. That's man, true. That's tough. I mean, good call on being on the other side of the rope. That would have been a hell of a 5 roper to just hit you from the other side of the sidewalk. So, ooh, man. Yeah, that would really ruin your day, though. I would imagine I would. I don't phone it in often, if ever. You and I haven't taken a sick day since I don't know when, before we met.
Yeah, seriously.
But I would maybe insist that if you got nutted on your Sunday walk, There's like level. The bird shits on you is one thing. Like, dude just sends a. Oh man,
there's people taking mental health days because of the election.
Right,
unacceptable.
Dude.
You get a mental health day if you get nutted on.
There's levels to this, 100%. Yeah, and you know your party doesn't win, and you get nutted on. Whatever, take two. But like, yeah, it's like that scene in Super Troopers or in Superbad. They're like, yeah, I just assumed there was semen on everything. That's that's unfortunate, man. You want to avoid that if you can.
Yeah, really. I mean, I was hoping that I could get some good mental work done, and nope, just this guy just fucking running laps, jerking off in my brain the rest of the day.
The thing is, you're going to be keeping 6 for that guy now. Like you're like looking both ways when you leave your house. Like, where's the jerk off guy? That's a problem.
Yeah, no, that's not something you would be looking over your shoulder for.
No, definitely not. Well, I mean, I'm not sure how we segue out of that, but clearly it was on your mind enough to kick off an episode with it. So
I just need to share with someone. This is like, I haven't been to my therapist in a bit, so this is where it gets leaked out.
So you thought burdening it with tens of thousands of people was the move?
Yeah, I think so.
How do you feel?
You know, I feel a little bit lighter, but I'm still gonna carry a knife on me in case there's a jerker offer around the corner.
Oh no, he gets. Can you conceal and carry in California?
A gun?
Yeah.
You can do it wherever you want. You just have to accept the consequences.
Right. Fair play. You can conceal and carry in Canada if you want to go to prison for the rest of your life. So you can't carry. So this is like nothing to do with anything, but you can't carry a gun in public in California?
Some people can. It's, from what I understand, it's a pretty expensive and political process. Like, you have to know the right people in the right places.
Oh, wow.
Pay the right people in the right places. Like, I think it's one of those things you like donate to a campaign and somehow it gets pushed through.
Interesting.
I haven't looked into it in a while, but there are places you can, and there are places where it's easier to obtain a concealed carry permit. Where I live in the Bay, it's pretty difficult to do so.
Okay. Yeah, the thing with a knife, though, right, is you don't want to get that close to the dude who's jerking off.
If I'm in cum shot distance of this guy, I'm putting a hole in his rib cage.
Yeah, that's a fair trade-off. I still think he's coming out ahead on that one. There's way less trauma with a puncture wound than just getting nutted on by another man. Yeah,
that's too many fluids of a homeless man that I'm going to end up with on my body.
Right, yeah. One would arguably be too much, but...
2 is way too much.
2 is, yeah. I don't know how much 1 is. I just know that 2 is too much. Yeah. I mean, maybe can you invest in throwing stars or something like that? Or like keep a bit of a buffer from this guy? It's like a slingshot, dude. I do not. Macintosh and I were walking through Toronto a week before last. And some guy poked me in the stomach. And I just saw, like, before this finger hit my stomach, my fist was already like ready to go, and Macintosh was like, "Oh, like you're like ready." I was like, "Yeah, dude, Toronto's wild." I don't. But he also didn't have his dick in his hand, which may have been a different story.
Yeah, I'd be more willing to hit someone that poked me than someone with their dick in the hand.
Yeah,
like it's fight or flight. I think it's flight in that scenario.
I think so. You want to create some distance there. Not an ideal scenario. Well. On that note, welcome back, everyone, to RX Radio. Preview of coming attraction. Actually, no, we're not going to talk about anything to do with this for the rest of the episode. But
and let's not use the word coming either.
Yeah, dude, remember that time we reshot the L1 at like 3 a.m? And
yes.
Okay, we'll leave that aside because we'll just end up down the same rabbit hole. But welcome back, co-host Jordan Shallow, Jordan Jiunta, episode 7,896, probably. Today, other than avoiding conflict with masturbating homeless people, we thought we would get into a little bit of a prescriptive episode around lower back pain. Now, I'm sure it being episode 700 or 7,896, probably, we've covered this more than a few times. It's interesting because I don't ever remember what we say on podcasts. Do you have a good working no, okay, you're the same.
There's things that I say on repeat. I just don't remember where I've said them before.
Yeah, that's fair. And it's nice because I'll get, a lot of people listen to the show. And if you're listening, first time, welcome. If you're a returning guest of the show, do me a favor. could you subscribe? We don't ever ask, but I think you have to for it to work. Because you just think logically, people, if you're listening to this, it would go a long way if you hit the subscribe button. I have talked to in person more people unprovoked in the course of the last 7 years about the podcast than we have subscribers of the podcast.
Yeah.
Right. The number of conversations, like I was just in Singapore a couple of days ago, and the number of conversations I had from the podcast, and I was like, no, the number of conversations I have do not match the number of subscribers that we have. And if we could get that to match, perhaps we could dethrone all the old people talking nonsense about fitness who are just getting into it as a ploy to make money. That's what it is, right? Like everyone's on board with that. Everyone understands that, like all of the emerging health and fitness podcasts of anyone in their late 40s and early 50s is just getting into health and fitness because they know that's where the money's at. Like we're like the bane of health and fitness. Like we were born in it. They just adopted it type shit. So like if you're listening, Spotify, iTunes, whatever, YouTube, subscribe or whatever the button is, just do that thing so that in a couple of years we can actually be shoulder to shoulder with you. And then I think we'll have some sort of podcast celebrity boxing match, which I really like our odds in that space. I can't think of anyone in the top 100 that would prove to be, especially if it's a tag team, maybe a wrestling match.
Like a ladder match?
Like ladder match. Low key, if all this goes bad, which it very well could, me and you at WWE tryouts would be a fucking problem. I think we could go big.
What's that? Man, I've been closer to doing that in the past than not.
I have a contract in my inbox. I'm not joking. I flew to Las Vegas. There was meetings.
Dang. Yo.
Yeah, dude. I passed up the dream for this.
Damn. You could have taken on Stone Cold Steve Austin? That's legendary.
I could have taken on a methadone addiction and a young suicide. It's probably the trajectory of my amateur wrestling career would have been that. Would have been like getting a few chairs to the head thrown through a table and then ODing on,
that's definitely happening in an alternate reality. Like that played out.
Oh yeah. I'm just glad I'm conscious in this one. Anyways, the point of today is to get prescriptive on low back pain. And I like that we have, I don't know what episodes we've discussed in the past. I'm sure you and I have in plenty of formats and plenty of times, but it's always cool to see how the thought process has evolved over time. Now, I think there are some principles that stay steadfast, and I think there is some emerging research and some emerging ideas that allow us to kind of update our software when it comes to low back pain. Now, I think the most useful use of this time is to go broad spec with it and have this be a resource that if someone's listening, they can send it to someone who maybe not be as attuned to health and fitness. They can timestamp it and be like, okay, if you want to just get to the good stuff past all the jerking off, go to, somewhere around the 12 or 13 minute mark, and we'll kind of get into it. So I think just like a heuristic, like a low back pain heuristic. Now, we can't use that word on a title because no one knows what the word heuristic means on YouTube. So we'll have to change it. But an approach that works for most people most of the time, I think would be an interesting conversation, and keeping it geared to, the novice level or beginner level lifter or enthusiast, someone who's trying to get in shape, but fears the all powerful boogeyman that is low back pain. Where would you start your prescription, prognosis, diagnosis, etc., with that constraint in mind?
Yeah, I'm going to take the approach of talking to someone that is encountering this that maybe doesn't have any background knowledge on it, because that's the conversation I find myself having on repeat all the time. And I've probably said hints of this in the past on the podcast, but I think stuff like this, unless it's really what you do, like if you work with back pain patients, it's something that needs to be repeated. But there's always a conversation in my mind that needs to be had around pain versus discomfort, right? And pain is going to be something that It's a stimulus that it's basically a negative feeling. It's something that doesn't feel good. That is a warning signal that if we continue to do this, then there's going to be a negative outcome, right? Versus discomfort, not necessarily the case. It's a negative sensation, yes, but in certain cases, it could be a positive outcome that comes from pushing through this negative sensation, right? So, like a distinction that I'll make is like, I don't know, if I were to stab someone in the ribs because they try to jerk off on me, like that's pain that they're going to feel. And if I were to continue to do that, there's no positive outcome that's going to happen for that person. Versus if I'm doing some Bulgarian split squats and it starts to feel uncomfortable and I continue to push past that and I keep going, and then there's going to be a period where, yes, it's, SRA, like recovery, adaptation, all that, like I'm gonna have to recover from it, but there's a positive adaptation that's going to come from continuing to elicit that sensation of discomfort. So that's where this all starts for me, is identifying what you're feeling. Is what you're feeling actually pain, or is it discomfort from being in positions that you're not used to being in, different loading parameters that you're not used to? Is it soreness? Is it something that is from a workout that you're doing or a new regimen that you're starting, that now those muscles are sore and something you're not used to feeling? So that's going to be the first distinction, is understanding the sensations that you are feeling. Like, is this an acute injury? Like what's the mechanism here? Was there an incidence that things felt fine and then you did an extra rep and then suddenly they started to hurt after that rep, with it seemingly being no different than the one before it? Or is it something that kind of gradually built over the course of the set and then dissipated after the set? So those are kind of two distinctions that I'll look for here. So anytime someone comes to me saying they have low back pain, the first thing I want to know is how did this happen? Was there an incident? Was there an injury? Is it something that comes and goes? Is it something you've been dealing with for a long time? Do you have other injuries that could have contributed to this, like maybe a previous ankle, knee, hip injury? Or is it something that kind of comes and goes with some sort of correlation we can make to an exercise that you do regularly, or a new exercise that you've kind of put in? Or is it a sensation that you get maybe in states of higher fatigue or lower recovery? So understanding kind of the origin of what they're feeling and getting some sort of understanding of the sensation that they actually have when they're describing it as low back pain. That's where I think this conversation needs to start. Regardless of that, I think that we can start to pull things from it and start to learn different things. But if we're talking like actual pain, like there's an incidence of injury and there's something that this is a negative sensation, that if they continue to push through, there's going to be a negative outcome, then I think we need to start to put this, kind of categorize this into, okay, well, there is an injury here. Now, what kind of injury are we dealing with? Is this something along the lines of muscle spasm? Is this something along the lines of muscle damage, ligament damage, or like a disc issue? Those are kind of the major things that we'll see with low back pain. And that being in the gym, I think a lot of times things that are a little bit more transient, but more in that pain category, they kind of tend towards the side of muscle spasm to like mild muscle injury, like a strain injury. Things that are more acute, then they tend to be more like real muscle damage, ligament damage, or disc issues. And those are kind of the two ways that I'll batch them. Is this like spasm or minor strain, or is this major strain, ligamentous, or disc issue? And then as you kind of batch them into those categories, then you can start to think about, okay, what is healing time for tissue, or what is stressing out tissues that shouldn't be stressed to this degree in X, Y, and Z movement patterns. And you start to ask questions to pull information from that person to really understand, okay, this is how we got here. Now that we're here, how do we reverse this? How do we come out of this? And how do we start the rehab process?
Yeah, I think it's useful for the beginner to highlight some red flags, because I think knowing the difference between pain and discomfort is usually a like reductionist reason of like, okay, I'm in discomfort because I'm not in these things. So like identifying like, okay, red flags for pain when it comes to a low back issue. I think top of mind is always sort of a hallmark of an underlying nerve issue, which would be, is there shooting pain, right? Mm-hmm. Is there a part of radiation, or is there a component to this injury that radiates? Now, not all, it's not the most sensitive or specific, but it is useful in its presence to approach, proceeding with caution. So, I think a few red flags of like, okay, you are in some state of pain or discomfort and you don't know. Pain being sort of this behavior change mechanism, which is useful because, if we want to abide by that stimulus and change our behavior, then continuing on working out the way we had been may not be warranted. So I think it's useful to like, okay, I would say, subjective interpretation past a particular threshold may be useful. Now, the subjective nature, that meaning like, hey, man, is it a 9 out of 10? That's probably pain, right? Where if it's a 4, you might want to reconsider whether or not you're in pain per se, or it's just discomfort, right? So figuring out a subjective scale, which might be a red flag. So, it could be 7 to 10 out of, or 7 or higher out of 10 pain on a scale might be something that you might want to pay attention to, right? The second being, is there radiation? Do you have symptoms or sensations that start somewhere and then travel somewhere else in the body, right? Like low back, do you get a shooting pain into the butt or into the back of the knee or into the foot and ankle? I don't know what's going on with Riverside today. I'm just full of magic over here. For those of you following along at home, it just did something. Can we turn that off? I was on a call. We got to turn it off. I have balloons coming up the other day. Get the thumbs up pops in every now and then because the way I hold the mic, it's a whole thing. So yeah, initial red flags. All right, you're in some sort of pain or discomfort. You don't know. Triage to this list. Is it a 7 out of 10? I would say 7 out of 10 for most people is a good place to start. Are we above 7 out of 10? Yeah, let's call that a yellow flag. Is there radiation? Let's call that a yellow to red flag, right? So are there associated, and this is going to be tough for some people, but we're going to walk through this. Are there associated, motor or sensory deficits? Meaning, there's low back injuries that might make it difficult for you to lift your foot, right? It's a condition called drop foot associated with the sacral nerve issue. So if you have a hard time, like with in that case would be a motor dysfunction, other notable motor dysfunctions that may classify your condition as painful and not just discomfort. Oh, I don't know, like losing control of your bowels and or bladder, that would be a problem.
That's a big one.
That's a big one. So those are a few that come to mind. And that's just in the acute phase. I think it's also worth having a conversation as low back pain being so persistent, so prevalent, that one of the easy ways I think to differentiate pain from discomfort is through time, right? So, there may be something that in the short term with, when something hurts, and I've had this happen time and again, and I've always found myself wondering, or I have found myself wondering, is this pain or discomfort? Is what happens in 24 hours? Where are we at in 72 hours? Where are we at in, I would go about as far as a week. If we hit a week, and that would be on the outer limits of where I think you should be. I think somewhere between 72 hours and a week. If you are still undergoing the consistent perception that may be pain that checks some of these prior boxes, you might want to, go seek some sort of care alternative to just your own management. And as I think that's really useful. I've had injuries or I've had perceptions that in the first 24 hours I think I'm fucked. Like I think I'm headed for the surgery table. And even me who's dealt with these issues professionally for a decade now, when it happens to yourself, it's always different. And so, but I think time is a really useful metric to parse out whether or not we're dealing with pain or whether or not we're dealing with discomfort, because it may be that in the first 24 hours, like you're going through it. and then it settles in. But there's also cases, and this is where time I think is particularly useful. There might be cases where in the first 24 hours you feel fine, right? And then over the course of the days 3 and 4, you start to regress, or what likely happened, you start to express the perception that is no longer being masked by other systems that might be guarding you from that pain, right? So a car accident is a really common example of this, where the first couple of days you might still be running some sympathetic operating system that's shielding you. So just to recap quickly, step number 1 when triaging and troubleshooting low back pain is first understanding the criteria of whether or not you are in pain or discomfort. Some red flags that might indicate to pain: 7 out of 10 perception of pain fairly consistently. Dealing with any sort of nerve related issues, whether it be lack of sensation, skin, touch, heat, whatever, and a lack of motor output, right? If you have a motor deficit, can't move a particular part of your appendages or what have you, that too is going to be a problem. Then when we get into the timeline, if you have something that feels painful in the short term, give it a few days and see where things sort of percolate down to. But vice versa, even if you feel what may be something that is presenting as discomfort, would too give it a few days to see whether or not that discomfort is true to form, whether or not you're dealing with discomfort as some residual from some masked issue that's much larger than that. So I think, out of the gate in managing low back pain, understanding whether or not you're in pain is, I think, a logical first step.
Yeah. I think kind of to pair with that also is if we can start to understand, and this is getting towards intervention, but the things that make it feel better and the things that make it feel worse, right? Palliative versus provocative towards the pain. So there are going to be certain ranges of motion that may have no effect on what you're feeling. There may be some that increase pain and do so in a way that, again, is not going to have an advantageous outcome if we continue to move through those. So that can be a starting point when you're starting to sort through, okay, I have this issue. I've determined that it is low back pain. There is some sort of injury present. It's something I'm going to need to work around in terms of building back strength, coordination, awareness, to getting back to doing the things that I want to do. A really easy way to start that process is understanding the things that either have no effect on the issue, or the things that make it feel better. And those are going to be things that you can kind of put into a bucket of, okay, these are things that are tolerated well. We can continue to do these things, and it probably won't have much of an effect on the issue, or it will have that palliative effect on the injury that we're having. Is that these are things that are going to make it feel better. They're going to relieve the muscle tension. They're going to allow me to move with more freedom and less pain. That's a really valuable understanding to have, because that's going to be essentially what makes up the beginning of your rehab protocol, is doing the things that make it feel better or don't affect the issue. And that's how you actually rehab pain. It's not just resting until 6-8 weeks and then trying to do the same shit you've always been doing. Because if this injury happened in the gym, that means that something has to change. It means that what you've always been doing is the thing that caused the injury. It caused the issue. So there needs to be some sort of change there. So if you can interpret the things that make it feel better or don't affect it, those are the things that you want to start with. And the things that make it feel worse, those I put into a bucket of, I kind of categorize them as, okay, is this something that we're unsure about? Like, it doesn't feel good, but it doesn't feel bad. Okay, that's great to know. Or is this something that it feels really bad and we're not going to do this? And then once we can kind of rank those things to the things that are more tolerable to the things that are less tolerable, then that's going to kind of dictate the order in which they're going to come back into that exercise progression. Is that we can take that first thing in line, the thing that it doesn't really make it feel better. It's definitely not no effect, but it doesn't make it feel terrible. Then that's going to be something that after we have a period of time where we're doing things that are palliative to the issue and don't affect the issue, we can bring this back in and we can test against that. Is that once we have a subjective understanding of, okay, this felt not great last time I did it, but now I've been doing these things for a while that make it feel better. So I'm going to test this again. It actually feels better. Then that's going to be a subjective sign of progression, that whatever the issue is, is getting better, so I can tolerate things that I could not tolerate or were not well tolerated before. So building that understanding and kind of ranking those things is a really important part of the assessment process, because it actually gives you a starting point. It gives you a place where, all right, I have an understanding of the bounds on this pain, the ranges of motion or the specific movements or loading parameters that I can do and the ones that I can't do. So I have a starting point. I don't have to just rest and do nothing for a while before I start to get back in the gym. And honestly, for low back pain, because low back pain can be pretty gnarly, this could just mean that you're doing externally supported upper body movements for 4 to 6 weeks until whatever that injury is, no matter how acute it is, starts to calm down. And if tissues need to heal, then you're starting to get some tissue tolerance back. Then it could put you in a place where maybe you're starting out not doing anything for the lower body to allow that to heal, and just doing things that aren't going to require much core activation or core bracing in a time period where you actually need to heal. Because that is a part of this, as I kind of started off, is that there's things that are going to be categorized as low back pain that are not due to tissue damage, and there's going to be things that are low back pain that are due to tissue damage. So if it is tissue damage, then there might be a very real consequence in terms of healing time before you can start to load those tissues again and do so in a way that's going to be productive in the overall grand scheme of getting things to feel better. So understanding those two sides of it is what makes it feel better, what makes it feel worse, and then slowly starting to dose in those things in a progressive way where you're getting an understanding of what feels bad and then how you can test against those over time.
Yeah, I think the inventory of intolerances is really useful. And it may be difficult for some to know exactly. And I think it's really, it's good to impart some clinical wisdom on people and be like, okay, there are going to be 3 planes that we're primarily concerned about. You have hurt your back. Maybe it's pain, maybe it's discomfort. Can you, standing or seated, bend forward without pain? Can you standing or seated extend backwards without pain? Yeah. That is likely, more often than not, one is going to be painful and the other is going to either be null or palliative. There are some cases where both are painful, and that could make life a little bit difficult. The second is going to be lateral flexion. Can I side bend to the left? Can I side bend to the right? Are one of these palliative? Are one of these painful? And then lastly is going to be rotation, standing or seated. Can you twist more or less your spine one way or another? It's useful to categorize your pain that way and be very specific about the planes and sides you you can move through versus the planes and sides you can't, because that will help inform exercise selection moving towards that intervention. And I think one thing while we're in the process of appraisal and assessment is, and I know we've sort of set out and said, hey, look, this is the beginner, but as we transition now into exercise prescription, as the tolerances and intolerances are going to really help be our guide in the initial planes of movement and exercise selection that come with it, is you need to understand your strength going into the injury. Like, how strong are you going into the injury? Because the one thing that you'll find, and we find this in ourselves and others, is the thing that will accelerate someone's rehab time or recovery time for an injury of all sorts is going to be the baseline strength to which that injury occurred. The stronger you are, the quicker you will recover, period.
Yeah.
So it's hilarious to me to see, and it's not funny, but I don't know. I find it funny that in the avoidance of injuries, people, one, you can't ever avoid injuries, so just don't try, but at least do the thing that will help you recover the fastest. If I had to pick one physical attribute to get myself out of pain quickly, what I'm picking is a very high baseline of strength going into the injury, right? So as the podcast world gets a hold of fitness and old people start to really pollute the idea of strength training and resistance training, hypertrophy, rehab, injuries, and all that, they so often take away people's best tool to fight the thing that's inevitably going to happen anyways, right? So, if you're afraid of injuries, wrap yourself in bubble paper and stay the fuck at home and don't do anything for your life until you die. If you have a slightly more testicular fortitude and you decide to do something, understand that resistance training is inherently safe, and it is going to be the safest way for you to be able to acquire the one skill or tool that you can bring off the shelf to help you rehab any injury faster. So rather than undertraining yourself and trying to avoid injuries, the more strength you can acquire, you're actually arming yourself with the known best antidote to the thing that's inevitable anyways. So that's a key component to this whole process is, one, don't let it deter you, but two, try and accelerate the strength process as quickly as you can to not avoid injury, because that's impossible, but you want to aim your trajectory and your training towards getting as strong as possible, because that'll be the thing that pulls you out of any tailspin the fastest.
Yeah, I really like that. And the way I think of it is there's the discomforts that come with training and with getting strong. And you can either accept those, or you can accept the discomforts that come with not training and not getting strong, right? Either way, you're going to feel it, but you're going to have more control over it if you accept the discomforts that do come with training. And I guess from there, like the next point that I would make that goes along with that is that just being strong helps. The thing that happens with being strong is you develop an inherent awareness of how to use your body, right? And aside from catastrophic events, which do happen, especially the more of an outlier strong you are, the more these things will happen. But most people will never get there. So realistically, low back pain, to me, in the gym, it is caused by not understanding how to control your pelvis. That is probably the number one cause of low back pain with training, right? And with that, it leaves a lot of room for improvement. I think people get to a place, and especially people with a lower training age, is they'll see progress as they start training more consistently, but you can get a level of progress without understanding how to control your pelvis, how to use your core, and really having the level of awareness to interpret any sort of imbalances, discrepancies, or biases that you have from side to side. But once you get to a certain threshold, that lack of awareness around pelvic control or the way that you're moving, specifically more in like bilaterally loaded, non-externally supported movements, and a lot of times it's going to be barbell movements, that is going to be, you're going to cross a threshold where you're strong enough to be dangerous to yourself and you lack the awareness to protect yourself from that. And that's where people run into low back pain with training, right? It's because they're doing things at a repetitive enough pace that they're starting to incur these repetitive stress type things. And those can be some of the more minor things. Or if it is like an issue of intensity, they're doing things at a great enough intensity where they can actually cause damage with that lack of awareness. So when we're talking about the rehab process and introducing exercise back into the regimen, that's where it always starts with me, is understanding how to use your core. And that could be very base level stuff, because there's a lot of people I've dealt with that have gotten reasonably strong without that understanding. And that's why they end up in this position. So understanding how to use your core and then building awareness around how that pertains to using your upper body and your lower body, right? You can get lower back injuries with a lack of awareness of how to use your core doing overhead movements. That's not uncommon, but it's not necessarily the way that people think that this stuff works. They think like it's ripping a heavy deadlift or like a squat goes wrong or something of the sort. But there's a lot of different ways you can fuck yourself up if you don't understand how to properly brace your core. And the reason for that is that the structure of our lumbar spine, or the structure through kind of that region of our body, is all posterior, right? We have our lumbar spine in the back. We have no structural stability in the front. We have our pelvis, which is a very rigid, structurally stable region of the body. We have our rib cage through our thoracic spine. This is a very structurally stable region of the body. Through our midsection, through our abdomen, we have our spine posteriorly, and then we have musculature in the front of our body. And there needs to be some sort of understanding of how to safely use that musculature to disperse force in a more circumferential manner. And if that doesn't exist, then people are going to start to bias loading the spine. So that's where we start to run into issues with, even in best case, repetitive stress, like muscle spasm, muscle tension, like psoas tightness, like using the erectors to brace, like an anterior pelvic tilt. At best, it turns into irritation and ineffectiveness in movement. At worst, it turns into like disc herniations, like muscle injuries, like anterior hip pain, labrum tears, things like that. Is you can get a lot of these issues just from moving in a very poor way for a long period of time. So that's why anyone that comes into me with an issue pertaining to the low back, the number one thing they need to know, they need to learn out the gate, is how to use their core. They need to just understand pelvic positioning, how they can create a more neutral pelvic positioning, just to disperse force in a more structurally stable manner through that region of the body.
Yeah, I think if I'm going to throw my hat in the ring for intervention, that borderline on prevention of re-injury, which again, prevention of injury, prevention of re-injury, this is a difficult game to play. But if I were to hang my hat on one metric that we can really, we can track, which is super useful, that I think will move the needle. I don't know, it's getting crazy out here, dog.
Wow.
That I think it will really move the needle for people in rehab is losing body weight. I cannot stress enough. And this is something that anecdotally, almost every person who sets out to lose body weight for whatever reasons one might do that, whether it's general health or what have you, one of the ancillary benefits that they didn't realize until, and I to a certain degree am a byproduct of this, one of the things they don't realize is how good they feel when they're lighter. Now, this is something that you don't want to wait until you're hurt to make this type of change, but it's a great time to make this type of change, and you can easily justify it to yourself because your outputs are going to be hindered. Now, it's worth having the conversation, especially if we're talking entry level. Like, look, resistance training does not burn that many calories, right? It's not going to effectively move the needle and balancing the equation that helps you lose weight. It's just not. Like, you can grab a yogurt off the shelf and fuck any caloric deficit that a resistance training workout may have provided you. But that being said, if you are limited on your outputs because you are injured, this could be a great time to justify to yourself looking to lose weight and put yourself in a caloric deficit. There's two ways that I would, frame this to someone. One, it's going to, a diet that is in a calorie restriction, and depending on by which means you choose to get there, but most often than not, you're going to end up in a position where the inflammatory state of your body is going to be less, so that your injuries will, and whatever inflammation comes with, will be exclusive to the presence of tissue damage that need to be recovered, and not just this arbitrary house fire that's just burning inside you for no reason whatsoever, right? Which is commonly the state of people who eat in a caloric surplus. There's this metabolic milieu of pro-inflammatory factors that are going to and can and going to trigger the perception of pain. And then the second one, which I think is the more logical one, it kind of feeds into this idea of load management, right? Because every low back injury I have ever encountered, almost invariably, has an element to the story or to the mechanism of injury that's like really lame, right? It's usually, whether it's in the gym or whether it's just sort of in day-to-day life, it's usually in positions that are relatively underloaded, so much so that there is a general lack of awareness of their body position, right? There's seemingly to them such little threat of the load they're in or load of carrying the position that they're in, that there seems to be a general like laissez-faire nature to their posture when they're doing whatever activity they're doing. And it's that inhibited state that allows these tissues to really, bear the brunt of this force. So it goes without saying that if you were to lose even just a couple of pounds, what that weight loss does to the systemic fatigue of your body is what is called a super linear scale. So what I mean by that is, for every pound you decrease and every step you take, those things multiply on top of each other, and you have like a super linear or logarithmic amount of stress that is being decreased from your body, right? So if anyone's ever worn like a weighted vest and felt just how like difficult it is to being a little bit heavier, right? Whether it's like you're going for a walk or you're training for something and you have some need to wear this vest, whatever it is, you realize like just how difficult. It doesn't even have to be a weighted vest. Take someone that can do a pull-up and give them 5 pounds around their waist and watch them being incapable of doing a pull-up, right? It does not it does not take a lot of weight to add an excessive amount of challenge to the musculoskeletal system. So when we're dealing with low back pain, I think it's an amazing time to start looking at the caloric ins and outs of that person, because in the acute phases, you can really manage undue inflammation with proper nutrition and hydration. And in the long term, if you can peel back unnecessary body weight, if I were to track the most accurate predictor of re-injury, it's going to be those people who don't lose, but rather gain weight in their acute phases of their injury. If I were to track the most accurate metric of a decreased likelihood of injury, which again is very hard to predict. Injuries are tough. Pain is a very complex set of neuroscience or subset of neuroscience. It would be that person who decides to lose them, and within reason, you don't want to lose muscle mass, but a person who decides to lose weight during their rehab process is going to have a substantially lower risk of re-injuring than someone who stays the same weight or greater. Much to your point earlier of like, hey, something's got to change. There was a confluence of events that have led us to this point that we need to make sure when we're rewriting this roadmap into the future to avoid this pit stop. But we need to make sure that these roads look a little bit different, that our training looks a little bit different. And I think there is a meta principle of load management when it comes to actual body weight that a lot of people miss. So I would challenge a lot of people, because look, I'm literally getting on a call at 5:30 with a friend of ours who has recurring low back issues. And that is top of mind for me, and not that he's a big guy, but he's clearly working outside of his payload, right? So something's got to change. If I could get him down to 8% body fat, I doubt he has these problems anymore.
Yeah. And I'll kind of piggyback off of that. I think there's a bigger conversation to be had around recovery on the whole, is that if you're getting into this position, then yeah, the workload is outrunning the recovery, whether it's in a more local sense or it's in a more global sense. Like if the goal is to lose weight, then you do need to prioritize dietary choices, yes, but also look at sleep, look at hydration, look at stress levels. All these things are going to play into your ability to, yes, lose weight, but also your ability to recover from the stresses that you're placing yourself under on a repetitive basis. So I think that's, on the whole, that's a conversation that needs to be had with someone that is undergoing an injury, because now there's an increased demand for recovery outside of, maybe the demand that they've been neglecting, but they've gotten to this point where now it's that much more important because there is tissue damage, or there is that stressor now that is an additional stressor in their life of feeling pain when they get out of bed, when they're sitting in the car, when they're sitting at their desk. That's you can't ignore that. And that is going to increase systemic stress on a day-to-day basis. So there needs to be some sort of increased stimulus of recovery for that. And that could be quality of diet, which plays well into your point about losing body weight, decreasing, again, systemic stress on the entire body. But then also your body's ability to recover and repair and rebuild tissue. Is that if you're not sleeping well, you're going to be at a decreased capacity to be able to do that. If your diet doesn't support it, you're going to be at a decreased capacity to do that. If you're not managing stress in other areas of your life, that's going to accumulate, and overall allostatic load's going to increase, and you're going to probably feel your pain worse than you would had you not had that additional stress in your life. So that is a really important point to make, is that yes, diet, yes, losing weight, but overall recovering better is going to allow you to recover from that injury better as well.
Yeah, I think one last thing on the recovery side is we've talked about movement in a very specific sense. Right? We talked about resistance training, and I can't stress enough how important understanding your relationship with gravity is. Right. So
yeah.
there's movement from a local sense of like, okay, we are going to move in the gym in a particular way that doesn't exacerbate our symptoms, that hopefully is palliative, but at the very least is nullified and not provocative to the pain we're experiencing. That's specific movement. You want to be able to zoom out and find general movement that you can do. And this is really more through the lens of like an aerobic capacity practice. And the reason I started this off was talking about the relationship with gravity is if you are someone who has experienced or experiences the chronic issues with the low back, you need to understand that, you know, if you are on the unfavorable side of the relationship with gravity, let's say, that you need to be mindful of your more general movement practices as so far as their practices, right? Like if you're relatively overweight, walking might not be your friend in an acute phase of an injury, in pain, especially low back pain. Because if you understand that if you're walking around with a bit of a payload and your spine has to, sure, you know, the camera's been having a mind of its own lately. If you're walking around with a particular payload in your spine and or on your spine rather of a higher body weight, you might want to find a movement practice that is better scaled to your body weight. Now, again, this is going to be a moving target, understanding that you're hopefully in the process of losing weight through nutritional intervention, but there is going to be a palliative effect to the way that a general movement practice would improve your perception of pain, right? So there is going to be something that we can do, whether it's a recumbent bike, whether it's a stationary bike, whether it's swimming or walking on water. I think there's a delicate balance that needs to be understood when we're looking at exercise prescription, and that balance really hinges on that person's relationship with gravity, right? So if gravity is a little bit too formidable for their strength to body weight, we really need to find movement practices that get in where they fit in, right? They need to find interventions that will allow them to get their feet wet in movement in a way that's not further provocative, right? And as these 2 points come together, as their capacity increases, it will simultaneously pull that payload down and their body weight should decrease. But I see so often very generic prescriptions of general movement, walking, for example, that are actually counterproductive in acute phases of injuries, especially at the low back, given the person that they're being prescribed to. So being cognizant of that relationship will allow you to make better general movement prescriptions that are scaled to this fundamental underlying problem as to why they may have been in pain in the first place.
Yeah, absolutely. And I think kind of one more point that I'd like to make as we start talking general movement prescriptions is that everyone inherently has imbalances in their shoulders, in their hips, in their ability to buffer force through the core, through all three planes. So when there's a time where training capacity is decreased, say an injury, especially a low back injury, that's going to be an opportunity where you can now you can kind of move the target from, okay, progressing, I don't know, a back squat or putting muscle on someone's legs or whatever their goal pre-injury was. And you can readjust the sights and you can set the target at, all right, what I want to do is I want you to build awareness around any imbalances that you might have through the hips, through the shoulders. And these are things that you can do with very little load. So a lot of times it's going to have a very low impact on the pain that they're having. So this can be a time where the kind of base level, getting back to training, the number one thing that I'll encourage is building conscious awareness of how you're moving. And I already hinted towards one of the things that's going to be around. That's going to be core bracing. Yes. Understanding how to resist movement at the core while still allow the hip and the knee and the shoulder and the elbow to move in a way that's conducive for, force production down the line. But we want to do that with some sort of understanding that, okay, we're going to limit movement through the core, and we're going to feel what it feels like to do that through all three planes, resist movement through all three planes. But I also want you to be able to understand if there's a discrepancy in the way you're moving your right leg versus your left, or your right shoulder versus your left. And that boils down to understanding a little bit about mechanics, but really even more simple than that. It boils down to understanding how to brace your core, and if your foot's on the ground, to maintain full foot pressure. And if you can do those two things, that means that you're moving the way that you need to at the hip, the knee, and the ankle to accomplish that task. Now, once they have that understanding, then you can start to build that understanding of, okay, you know how to do this. Is there a discrepancy in capacity to do this from one side to the other? And then once you identify that discrepancy in capacity, that's the rehab process, is reducing that discrepancy, increasing their capacity on the side that has a decreased capacity back to symmetry, while they're still understanding or building their awareness around resisting force through the core. And the greater their capacity to do those two things, the safer they will be when they get back to any sort of loading parameters. That's the understanding that it takes to put them in a position to not overstress any specific area of the low back.
Right. And this is where injuries become such an opportunity to take a snapshot and an inventory of like your general health, right? Like Jerry Seinfeld had this quote that says, pain is knowledge really fast. And I think that's so like profound, and like the knowledge of where you're veering off course in so many aspects. Like I said, it's a confluence of factors that leads to pain, which makes it such a complex subset of neuroscience. But it should be seen as a global issue, regardless of where your pain is presenting. It should be seen as this is a much larger problem. This is a much larger problem at scale. We need to pay attention to all our systems, right? So if you have low back pain, let this be a call to action to take inventory of all your systems. Because what did we recap? Or let's do a recap. What did we discuss? We talked about understanding your intolerances in an acute phase. We talked about the importance of time in understanding, the severity of pain, troubleshooting red flags to see if you're, experiencing pain or discomfort. Then as we move more to the prescriptive side, there's specific movement interventions as far as moving through planes that you can, moving into planes that feel better, moving away from planes that feel bad, avoiding stuff that hurts, doing stuff that feels good. It can really be as simple as that. Then getting more into the more lifestyle, or getting into more of the lifestyle stuff, more of the nuances. This is where I think you have a better understanding of the perception of pain on the whole as you start to take, strategic approaches to get yourself out of it. If you just see pain as this local tissue phenomenon, then you're really going to be fighting this cyclical battle. But I think it's really illuminating for a lot of people. Pain can be a gateway into better health, because they don't realize the integrated system of systems that lead to getting someone out of pain, which are the same systems that lead to someone getting into pain, right? So it's very useful to, as you go through a rehab process for pain, and the low back is just an easy one because it's so prevalent. When you start to look at, general movement prescriptions versus specific local to regional or local to global movement prescriptions, like should this person be walking X number of steps a day, or should they be in a pool for now? Or should they be splitting their time between pool and recumbent bike and walking and getting graded exposures? Like, what is their nutritional state? How could have led to, what is, their allostatic load, their psychological stress? How could that be contributing? And it's unfortunately, it takes pain to stimulate a conversation about general health. And I think practitioners, if you're listening to this, you need to, in order to improve someone's perception of pain. And I'm trying to dance around using the word holistic, but you need to understand that pain is a light on the dashboard, not just of the mechanical or the physical, but the biochemical, the neurological, the neurophysiological. And in order to get someone out of pain, you need to start to improve their habits across all of those integrated system of systems, which will then bring someone to better health. So pain can be a great catalyst to a conversation that helps improve the general health of the people that you're working with. Or if you're self-managing, it's an internal dialogue you need to have about the general status of your health. Too often we look at a hamstring or an elbow or a knee as just this tissue thing, and we don't consider how the rest of the integrated system of systems are contributing to it. When you rehab people professionally, you start to realize very quickly that it's as much biomechanical as it is biochemical, as it is psychological, as it is neurophysiological. So as you start to expedite the process by which people are experiencing pain, you learn a lot about the potential ways to remedy this from even happening again in the future.
Yeah, that's a really good point. And I think to sum that up from my perspective, a successful rehab process leaves someone better than when they came to you, right? It should put them in a position to reach new heights in terms of performance. There will be structural limitations in some cases, but a successful rehab process puts them in position to perform better after that process than they were before.
Mic drop. We did it. My camera fucked up like 18 times. I'm going to throw this thing in the fucking parking lot. But that was good. I like that vantage point. I think, I don't think there are many people in the performance space that bang the drum of health and rehab, because it's so task oriented. It's like, we just need this knee to get back to play X, Y, and Z. It's like, no, I know. That's my goalpost too. I'm telling you, the fastest way to get there is not the straight line you're thinking in your head of just knee. It's the, and I'll say it until I'm blue in the face, it's the integrated system of systems, right? Not just musculoskeletal, but biochemical, neurophysiological, psychological, and the sort. So yeah, rehab should change. It should fundamentally change the way you train into the future, because if not, you're not learning from that knowledge that you got really fast per Mr. Seinfeld. So hopefully you guys enjoyed the episode. We will be doing more prescriptive episodes like this. So if you guys ever want to see anything specific to a region of the body, condition, rehab, anything like that, YouTube channel, probably the best place to reach us at. Just throw us a comment of something you'd want to see. If not, Jay, any closing thoughts before we wrap for the week?
I think that's it. I appreciate you guys tuning in. Appreciate you guys listening. If you made it past the first 10 minutes, thanks for being here.
Yeah.
We'll see you guys next week.
We'll see you next week.